I want to do is give patients and other people an understanding of what the approach is that I do and why I do it that way. And so when we see who we can help and who comes in to see us is people that fall downstairs or have a car accident or people that sit forever completely crooked and stupefy themselves in front of a computer. The reason why we do that is because when you look at joints in the skeletal system, the alignment of joints very much influences how the body works. If your skeletal system is crooked, it's going to put a lot of stress on your body parts. If you're biomechanically all perfect, you have much less wear and tear on your system. And that makes sense, right? Yeah. Muscles then are attached to the bones in the system, the skeletons, and they have to hold us in awkward positions, for example, or move us around. But look at what happens when we sit for a long time. The amount of pain we can get. Wrist pain is very common. Low back pain, shoulder pain, and neck pain. They're all very, very common for these people. So muscles react to joints that are not working well. Muscles react to crooked sitting skeletons and they contract. And what we can see down here, what's cool is if we put function back into that joint, the muscle spasm dissipates. So that's very positive. And that guy there, Kirkcaldy-Will, is a very important person in treating low back pain, has talked to us about why manipulation and all that is good. And the concept that I really like that people often miss is the pain gate. So in the spinal column, somewhere where the nerve goes into the spinal column, you have like a window, a gate, so to speak. And the pain stimulus can be interrupted there and not translate and not go into the brain if we put another sort of stimulus into that area. And what's that? That's proprioceptive. And proprioceptive stimuli are the nerve endings that tell your body where you are in space. That's why you can close your eyes and still touch your nose with your index finger. Why is that? That's because of that. So enhancing more of those stimuli will shut the gate for the pain to travel to the brain, and that's very helpful. This is the same concept where we have a kid run into the wall and we kiss its forehead. It's the same thing. So we can work that in terms of adjustments. We know that's a good thing. And what does then that do? That helps release muscle. But we can also go into the muscle. Because what happens when we injure muscle, look at how scarred that can look. So the muscle gets infiltrated with white scar tissue that's like the gristle in the meat. And it increases its risk for more injury, but it also decreases its smoothness of the motion pattern. Okay? And guess what? More re-injury because it's weaker. So we can work on it. As a matter of fact, this is muscle that got directly injured, but the muscle that is injured from overusing it by sitting crooked, same difference. So we can go in, we can do trigger point therapy, as you can see here, squeezing the blood out of the muscle, or do transverse friction myotherapy, which is we sort of pluck the muscles like the guitar strings and decrease adhesions that way. And that will reduce the adverseness of muscular adhesions and fibrosis. And that's just a fancy term of saying junk in there. Stuff that glues it together. The guy who gave us an understanding of that is Dr. Syriacs, another very famous orthopedic guy. So then we work the muscle, the bone. We could do that passively. I could do that on you. But then how are you going to stay better? We've got to reduce the risk of exposure. That's very important. Teaching proper biomechanics reduces the exposure and distresses the stimuli. Sitting, you want to sit up straight. Keep your head back. Sit on your sit bones, not on your butt. Reaching, you don't want to reach too far above your head or behind your midline. You take a step stool. Sleeping, you want to have on the side. You don't want the neck to be crooked. You want it to be straight. When you're on the back, you want the neck to have a little rounding to it. Pillow under the knee when you're on the back helps with low back pain distress. When you're on the side, it helps because it keeps the thighs parallel and that doesn't distress the low back. When we look at lifting, the most important thing is that you lift from your thighs and not from your back. So you hinge your your hips, and not round your back when you lift. Then the other thing is you don't twist when you lift. And then the third most important thing is when it's too heavy, be smart and get help. Don't do it yourself. Lastly, in our approach, we really want to look at building protection. We want to look at exercises to build muscle smart, not just bulk. So we want to do it in a way that neurologically stimulates the muscle. How do we do that? We do exercises on uneven surfaces, like a gym ball, the beach, a foam mat, stuff like that you have to balance a little bit. And if you use the muscle while you have to balance it, guess what? The brain then knows how to use that muscle later. And that's pretty cool. I put in a slide on chronic pain because chronic pain is kind of a challenge, right? A lot of people suffer under it, and we don't really know how to treat it that well, and then we give them pills, and that's the end of the story, and that usually doesn't do that much, at least not long term. The brain area where the body is represented in terms of pressure and temperature and all that, that's right by the hairline, that's an area, that area becomes less clear. So the representation of your hand, for example, is less clear in people with chronic pain. And so the absence of that clarity creates a painful perception in the patient's mind. They call that smudging. And what we need to do is we need to bring clarity back to it. And how do we do that? And the answer to that is motion. Exercises, passive motion, like I move your neck or your back, or we work muscles, that's motion. But also, if you're really bad off, even just thinking about moving. A topic for chronic pain a lot is fibromyalgia. And that's where a lot of pain happens because we have this cycle where the body is muscular. We have tension, and then there is daily stress, and the body gets overstressed, and then it gets into this fatigue and depression cycle, where then we sit around, or lay around, we can't move that much. Well, that gives you stiffness, that gives you more pain. So it's a whole cycle that's happening. Measured input again into the brain helps decrease that problem from a pain perspective. But often you have to be very, very careful because you can overdo it on fibromyalgia patients and overstimulate them. But assuring proper musculoskeletal functioning will very, very often decreasing that long-term pain and helping the system.